Dr. Wilber Sabiiti, a research fellow in medicine at the University of St. Andrews in the UK. I do research on tuberculosis, a disease that affects more than a third of the world population and is responsible for more than 1 million deaths every year. Tuberculosis is an old disease that still poses big challenges to the world population. And one of the challenges has been that it's very difficult to identify that the patient is sick of tuberculosis, which we call in clinical terms as diagnosis. And the second challenge is that it's quite difficult to identify if the patient is responding to the treatment that has been given to them. So for a long time, science have been using the method of growing bacteria in the lab to be able to identify if the bacteria have been killed by the treatment that was given to the patient. But tuberculosis grows very slowly in the laboratory and on average takes 2 months to be able to get the result. At the University of St. Andrews, we have come up with a solution by inventing a new technique that is able to identify the patient's response within a matter of hours. With this new technique, we are able to show that the patients who are responding quickly and the patients who are not responding, so that the best treatment can be given to them before they can develop drug resistance. And lastly, I would like to note that tuberculosis is a disease of poverty, and there is evidence to show that whenever economic levels of the communities are improving, the levels of infectious diseases like tuberculosis go down. And so using holistic approaches involving both improving diagnosis and treatment and also improving the welfare of the affected communities is the best way to solve the problem of tuberculosis in the world. Thank you very much.